Facts versus myths dairy dialogue. Myth. People with lactose intolerance cannot drink milk or consume dairy products. In most cases, completely eliminating lactose from the diet is not necessary. Small amounts of lactose are usually well tolerated and do not cause discomfort. Most people who have difficulty digesting lactose can still tolerate a single dose of 12 grams of lactose per eating moment with minimal or no symptoms. This is equal to a large glass of milk. Larger amounts of lactose may be better tolerated when consumption is spread throughout the day and taken with other foods. Fermented milk products like yogurt typically contain less lactose than whole milk because lactic acid bacteria partially break down lactose during the fermentation process. Additionally, the live cultures in yogurt or fermented milk can enhance lactose digestion in individuals who have difficulty digesting lactose. Hard cheeses, such as Dutch-type cheese and cheddar, hardly contain any lactose. Myth. I can easily replace dairy by calcium supplements. Dairy products are the main natural sources of dietary calcium in many diets worldwide. This is attributed to their ability to provide high levels of absorbable calcium in a single serving. A glass of milk, 200 milliliters, naturally contains around 250 milligrams of calcium, which is 25% of the recommended daily intake for calcium. A diet containing sufficient calcium can be composed without dairy, but this is not easy. Calcium supplements may be in addition to the amount of calcium that is obtained from dairy, but is not an adequate replacement as dairy contains more nutrients than calcium alone. Myth. Dairy products are bad for your heart health. Dietary guidelines often recommend low-fat dairy products because 2/3 of the fat in milk is saturated fat. Replacing saturated fat in the diet with unsaturated fat is advised as this replacement has been shown to reduce blood cholesterol. High cholesterol is a risk factor in the development of coronary heart disease. Although the saturated fat in milk may be suspected to have negative effects, scientific research has not shown that dairy consumption negatively impacts cardiovascular health. This might be due to the dairy food matrix, where product structure, product composition, and interaction between all the nutrients in dairy play a role in the overall effect on health. Myth. Plant-based drinks are just as nutritious as cow's milk. Cow's milk naturally contains protein, calcium, phosphorus, potassium, and vitamins B2 and B12. Since plant-based drinks may not provide adequate levels of micronutrients, some of these products are fortified. Naturally, most plant-based beverages cannot fully match the nutritional content of cow's milk, especially in terms of protein quality.